Hi, I'm Dr. Akhila and I'm a consultant obstetrician, gynecologist and a fertility specialist practicing at Fertilite IVF Clinics, BTM Layout, Bangalore. So today in this video, I'll be talking about what is the basic infertility workup for a couple. At the first consultation, it's very important for us to take a detailed history from both male partner and the female partner. When it comes to the female partner, age of the female partner is very important. If she is more than 35 years, then she need to plan her pregnancy as soon as possible. And the second one is her menstrual cycle, whether if it is regular or irregular, or if her flow is normal, heavy or less, should also be documented. And the third one is if any history of pregnancies in the past and also any abortions in the past also should be mentioned. And the fourth one is sexual history. What about the frequency of the history in a week? So many times she's having a contact in a week, and also if she's having any painful intercourse, that also will be documented. And the fifth one is any medical or surgical history in the past, that also should be mentioned to us. And the sixth one is if any addictions like smoking or alcohol, so all these should be mentioned to the doctor. And the seventh one is if any family history, any kind of illness in our family also should be mentioned. So these are the basic things that we ask in the female partner. But when I talk about the male partner, again in the male partner also addictions are very important, smoking and alcohol. And the second one is sexual history. If any kind of erection dysfunction or ejaculatory dysfunction, all these should be mentioned to the doctor. And if any history of fall in the past or any history of injuries to the testicles in the past, all these things should be informed to the doctor, because it will help us to understand what the problem is and where we need to act. So these are the basic things that we ask in the history. And the second thing is, before going for the basic test that we advise for, first you need to understand how the natural pregnancy occurs. During a natural intercourse, semen gets deposited in the vagina. From there, sperms travel through the uterus and it will go into the tubes where egg and sperm meet together. So here is where fertilization takes place. Once embryo is formed, after 5 days of embryo formation, this embryo will travel back into the uterus and will get implanted here. That is where we say pregnancy has occurred. So when we advise for the test, so we need to see at each level where is the problem is. So these are the ovaries, these are the tubes, this is the uterus, this is the cervix, and this is the vagina. So infertility, when I talk about the incidence, around female partner contributes to about 40%, male partner contributes to about 40 more %, and combination of both male and female contributes together of 10%, and the rest 10% is unexplained. Maybe we don't know any cause, like when we evaluate, we couldn't find any cause where we label this as unexplained infertility. So when we ask for the test in the female partner, one basic test is anti-Mullerian hormone. So anti-Mullerian hormone is a hormone which is released through the ovaries from the small follicles. So higher the anti-Mullerian hormone, better is the ovarian reserve. So when this is normal, we say a reserve is good. And the second one is transvaginal ultrasound, baseline ultrasound, which should be done on day 2 or day 3 of our periods. So when we do baseline ultrasound, what all we see is one, ovaries. In the ovaries, we will be seeing how many follicles are there in the ovaries, and the uterus. If any space occupying lesions in the uterus, all will be documented, and if the uterus is normal. And only one thing we cannot see in the scan is fallopian tubes. Fallopian tubes cannot be seen in the scan. So to see the fallopian tube, the second test that we advise is HSG or SSG. So here we push a diaphragm down and we see whether spillage is occurred or not through an X-ray, which we call as HSG. Again, this should be done between 7th to 10th day of our periods. And even SSG also can be done. In SSG, we push a saline from down to see whether spillage is noted or not. And again, this will be visualized through ultrasound. And even laparoscopy also can be done to see for the tubal patency, but laparoscopy is not advised in every woman. Only if we plan laparoscopy for some other reason, then only we ask for laparoscopy, otherwise we don't advise for. So these are the basic things that will give us picture that where the problem is. And the other general test that we ask for is thyroid test, prolactin test like TSH, prolactin, and blood sugars. So if any kind of hormonal imbalance is there in a female partner, then that also will affect our fertility. So that's why to complete our examination and to complete a test, so these three also should be asked for. But when I talk about men, it is very simple. Single basic test that we advise is semen analysis, which should be advised with a gap of 2 to 3 days of abstinence. Max up to 5 days can be done. So if semen analysis report is normal, then we say this male partner is normal. But if the semen analysis report is abnormal, then we repeat the sample after 6 to 8 weeks to see for the report again. If the report is the same abnormal, then again this male partner should be evaluated and treated. So to conclude, above are the basic tests that we advise for, but if there is any suspicion of other reasons, then we ask for additional investigations. Thank you.